Hi everyone, Farmington Mayor Nate Duckett. On today's episode of the Mayor's Table, we have San Juan Regional Medical Center CEO Jason Rounds with us. Jason's going to provide an overview of the services provided here at our local hospital, also the unique challenges we're facing here in healthcare in New Mexico, but more importantly, the unique opportunities that exist here in our community. Hi everyone, welcome to the Mayor's Table. With me today, we have a special guest, San Juan Regional Medical Center CEO Jason Rounds. Jason, thanks for joining us today.
Thank you for the invitation. It's wonderful to be here.
Well, it's a timely conversation, I think, to kind of discuss things happening at our local hospital. And we're going into the 60-day session, of course, in Santa Fe, and a lot of things are kind of on the table right now. And so I wanted to kind of get into what's happening with San Juan Regional, to kind of the concerns, the challenges, also the celebrations, because I know there's a lot of great things happening here that I think our listeners would want to know about.
Sure. So the 60-day session is coming up, and so there's been a lot of focused efforts on what's going to be on the mind of our legislature and our hospital and my colleagues kind of around the state. So big ticket items, which will not surprise anyone, it's going to be medical malpractice. That really is something that is, I wouldn't say unique problem in New Mexico, but certainly a critical problem affecting providers. As we are moving forward, most of our efforts in working with our local politicians and advocacy groups is really about access to care for New Mexicans in New Mexico.
Right.
So certainly we feel that pressure up here with physicians and providers struggling to remain independent or really find those opportunities to continue to practice here. Over the course of the last several years, we've really noticed primary care providers and physicians are moving out of this community or retiring and not practicing here. So we are hundreds, if not thousands of physicians fewer this time this year than we were 5 years ago.
In the state, right?
In the whole state.
In the whole state.
And even within the last year, looking at the enrollment of our providers and physicians, we know that we have, over the last 2 years, 1,000 fewer physicians overall for the state. So it's a critical issue. It's something that we need to be focused on as a community to really kind of solve these problems together.
Well, and talk about that a little bit, because I know, obviously my background in trying to understand med mal components. What the state has done is basically opened up a door to sue the hospitals, for endless amounts of money, it seems like. These nuclear verdicts that are being laid out, and somebody gave me a number the other day, and it's probably wrong, and I'm going to butcher it, but somewhere it's like $420 million of lawsuits have been levied against our hospitals in the state of New Mexico just in this last year, and maybe even shorter time period than that.
It has. It really has escalated. Some of these nuclear verdicts, as you call them, are really becoming problematic. There was recently a verdict in Albuquerque that I believe was to the tune of about $412 million. So these are not sustainable losses for really kind of any healthcare system that's in New Mexico.
Well, and this goes as far to say that these lawsuits are shutting down hospitals. For years, we've heard about the issues going on in Gallup. And that potentially now Gallup's hospital is in serious danger of not having the finances to continue to operate, and that leaves a huge gap of care. And that's like you said right off the bat, the biggest concern for our providers in the state is to make sure that they're able to take care of a very rural population for the most part. And how do you do that? Certainly in the situation with San Juan Regional Medical Center, the population and the region that you serve is very big. And we know that any of those types of situations, it's much more expensive to provide that service of healthcare when you're dealing with the logistics of, space and time and distance, and also the payer mix. That's a huge part of it.
Yep, you packed a lot into that question. So the one thing that I certainly enjoy about being in Farmington and the hospital, the unique relationship that we do have up here. We are an independent, not-for-profit 501c3 corporation. We have great relationships with the county and the city, and it really is about serving our community. So we're a mission-based organization, so really kind of reflecting on what's right for our community and kind of defining that and doing the right thing is where we spend a lot of our time. Healthcare is challenging, period. Kind of whether you're in New Mexico or anywhere else, but we do have some unique challenges and opportunities here in New Mexico. I do appreciate the focus of our advocates. The recognition that providing care in a rural setting is a different challenge than perhaps some of our urban counterparts are having in there. So being in New Mexico, there are some unique efforts and focus that are going on that are helping it. I think that really was the impetus behind the Healthcare Delivery and Access Act that we're expecting to benefit from, not only in this community, but statewide. Really focused on making sure that we are supporting the rural hospital systems and the providers to help with those access issues that are developing in our areas.
And I hear, even though we're up here in the northwest corner of the state, that we have one of the busiest hospitals, in ER specifically. I'll use them as an example. I believe it was 2021, and I knew we had a lot of travelers coming through the hospital at that time, but I overheard conversations from somebody who was a new nurse here to the hospital, and somebody who's kind of coaching them, and they're like, look, this is the busiest hospital I've ever been in. I'm overhearing this conversation going on, so just be prepared when you're here. You will be running hard. And so can you give us any context to that, to those numbers? What does it look like here versus the big press and Loveless and UNM?
So I've been in healthcare for a long time. I've been at level 1 trauma centers and academic medical centers, and I will tell you the folks and the traumas and the people that come through our ED is as complicated as anything I've ever seen. So I like to talk about we punch above our weight, seemingly, because we're not your kind of average community hospital. We're a level 3 trauma center. So that really kind of designates the type of care that we're prepared for, really kind of what we have available on site 24 hours a day, is a differentiating between like a level 1 and a level 3. That doesn't necessarily declare the type of trauma that we're dealing with, because we deal with level 1 traumas that come through there and have to be prepared.
Define that for people. What is level 1, level 2, level 3?
So within a hospital setting, it really kind of decides on, do you have 24-hour anesthesia services and access to certain trauma providers, basically on-site versus on-call.
Okay.
And so that's kind of the differentiation of that. So within our community, Troy Clark from the New Mexico Hospital Association was up and presented recently, and he had a great map that kind of showed the distribution of hospital systems. And you look up here in the northwest corner of New Mexico, and you've got one dot and a lot of vacant area around us, and that one dot is us. And so if you really think about the level of service that we need to provide and be prepared to provide for our community, it's really important. So we invest in services like neurosurgeons. We have 3 highly trained, well-competent neurosurgeons that are on call to provide that level of care. So if you're up in the mountains or hiking and fall down and crack your noggin, you're going to need to go someplace that can address that concern quickly. Sure. Do that. So we're happy that we can provide that level of service. So all the way from neurosurgery to cardiac intervention to other critical services and technologies, we want to make sure that we're investing in those types of technologies because it's mission-based and it's the right thing to do for our community.
No, very interesting. And I know that what we're dealing with here, and as you mentioned right off the bat, just the exodus of providers from New Mexico and trying to recruit new providers to New Mexico and to this area. Certainly the med-mal component doesn't help. A lot of states, and maybe you can put some context to that. I mean, I have, in my opinion, we need tort reform in our state on a number of different levels because when hospitals are sued, it impacts everybody's costs for healthcare. It costs everybody for more time and distance between yourself and maybe a provider who can give you that service. So these are serious issues. Are there other things that are impacting our ability to recruit professionals, doctors, nurses here to Farmington and to the state in general?
Sure. I'll probably answer that in a couple ways.
Sure.
So we are benefiting greatly from Farmington and what this community has to offer to anybody who wants to live here. So if you want to live in New York City or Houston, Texas, or have all of that available, Farmington's probably not the right focus for you. But we are finding plenty of folks who love the outdoors and the access to skiing in the morning and golf in the afternoon aspect of that life. So we're, over the last 18 months especially, we're having some really good results in identifying and representing what this community has to offer. So we're not bucking the trend to a level that I'm comfortable with, but we are certainly having great success in recruiting highly trained, well-qualified providers to our community, like GI services, something that's been much needed and under supplied here for a long time. We've got some new doctors who will be joining us in this upcoming year that will certainly help that. We're really also identifying those other gap service lines that we really need to have in our community that will make a difference as we kind of grow to that. The one thing that is different from other markets that I've been in that I have a concern for is really the independent provider in our community. I really don't know how they are making it. I am grateful that as we look at kind of our long-term strategy for this community, that we have an integrated system here that allows us to, I'm going to use the word shelter, but provide a different mechanism that providers can join us to where they do not have the same level of concern about, oh my gosh, how am I going to get malpractice coverage?
Right.
Oh my gosh, how am I going to afford the business operation? Oh my gosh, how do I deal with this gross receipts tax thing that is kind of unique to New Mexico and Hawaii? Is we're able to kind of provide a different structure for that hopefully allow them to really focus on the things they care about, which is taking care of their patients. But as I'm working with our partners and friends in our community, they have a really hard row ahead of them to remain independent.
One of the great areas I know that you've been trying to focus on and grow is the relationship with San Juan College and the certifications and degrees that are coming out of there for medicine.
Absolutely.
Maybe expand on that.
No, I'd love to. As we look at what is our challenges in healthcare, New Mexico has kind of a unique challenge with malpractice. So setting that aside, is workforce demands for healthcare across the country is probably the number one thing that we are all working on. Our solution, we believe, is going to be local. What do we have available here, and how do we partner with our local folks? There's about and I'm going to have the number in the ballpark, but probably undersupply of nurses in New Mexico of about 9,000 human beings. That's huge. So if you take a look at what's available in UNM, Lovelace, and Presbyterian, the three largest healthcare systems, there's a total of about six or 7,000 nurses in total. So we have a huge problem here. It's not just, hey, if you can pay your people more, you're going to solve this problem. It's like we've got to find and create that workforce for us. So we're going to have to look at creative solutions. You mentioned San Juan College. They have really stepped up with some creative ideas that we're going to partner and try some new things. So looking at scholarship, looking at recruitment of faculty, we know that there's about 38 to 50 additional students that are qualified that want to get into nursing programs that we just can't accommodate.
Right.
So we're looking at creative solutions to increase that student base so we can start getting them through the system and training. So that's part of the equation. San Juan College has been a great partner, but as we are looking at it, we've got to solve for radiation technologies and pharmacy techs and everything else. So we really have approached the community differently. We recruited a couple of specialists that are reaching out directly to our high school and education programs in Farmington and the surrounding communities about what can we do differently to prepare our students that when they are graduating from high school, they're ready to kind of go into the healthcare field. So opportunities around nurse programs, certified nurse programs, MAs, that type of things of what we can do. We're also working directly internally about EMS. I mean, training our EMTs in our community. I think there are 4 students in the program right now, and we have a endless need. So we're looking at can we teach these folks differently and do things a little bit differently. We're also reaching out to our surrounding communities, Navajo Nation, working with their educational programs about what we can do differently up in the Durango area and Fort Lewis College and Utah, and where everyone is training is. We're really presenting ourselves as a wonderful opportunity for clinical rotations or training sites or scholarship bases, really kind of reaching out within our broader community to try to work on this. But the baby boomers are here.
Right.
Healthcare needs are up, and we have a workforce dilemma and challenge that's not unique to us in Farmington or New Mexico. It's really a nationwide issue.
Well, it puts a lot of stress on the hospital and on the resources that are there.
And our caregivers, my goodness.
Yes, and I know the rehab hospital is a very, very busy place where there's a lot of boomers in that facility. I've visited there a couple of times. So, but it's interesting you brought up, getting into the high schools. My wife, who's a nurse and works for San Juan Regional, she got into this really with sports medicine class at Farmington High School. Coach McElmore taught the class. It was a very detailed and integrated look into the human body, and it was fantastic. But that's really what got her going, I want to be a nurse. And so I wonder if they have those same kind of classes. And can you do dual credit at a high school right now at San Juan and take some of those courses to kind of get those certifications? I'd be interested to learn more about that, but we'll bring Tony on.
I love talking about this stuff. And so as I am learning also, once again, we've got this unique problem. What unique solutions can we come up with? I'm also class of 2025 for Leadership San Juan.
Best class ever.
We're aspiring to be the best class ever, absolutely. But we had our educational day, so learned a ton of stuff, and the programs that are available, working with kind of the healthcare representative, focusing on these types of things. So leveraging those opportunities for dual credit or positioning our young people when they're graduating is, you've done all of the core work, now you need to have this last experience once you reach a certain age, and moving it into that. Really looking beyond 4 years or advanced degrees programs, but really working at, if you guys are ready to work, we want to make sure that we're investing in you in a way that you're coming out prepared with the right certifications, the right training, that you can enter these programs quickly. Can
you elaborate on which programs exist right now at San Juan College? If somebody's watching this, like, maybe I'm interested in this, what could they go there and do and then get on with the hospital?
I think that's, I know some of them.
Okay.
And once again, I know enough to be dangerous in that. So we've been talking with them about programs that range from the CNAs, EMTs, and the likewise, but I am still learning kind of that, what do you need that dual credit for versus what are you ready to go after high school. So we've invested some resources locally at our hospital to engage with these people who are developing these programs, working with Dr. Reyes, working with Ed DePass, Dr. Pendergrass, obviously, on really looking at a broader approach to solving this growing problem.
They are great people to work with.
Oh, 100%.
I feel very fortunate to be in this community and see all the big, I say the big players, from the college, the hospital, the city, the county. I mean, everybody really is rowing in the same direction and trying to find strategic ways to address these challenges. One of the other things that you all have added recently is, and maybe you can just tell us more about it, is making a student as a teaching hospital. Because I know now when you sign the waivers, we've got to let you know that there may be students in here. Elaborate on what that looks like.
So I had to bring notes on this one because we have a lot of activity. So a teaching hospital is a designation, so I have to be careful as we use that. So our aspirations is to engage better with the educational and training programs to benefit our community and our hospital. But we have lots of programs already underway. You may know that we have nurses that do rotations through there, and we're really reaching out to the communities to increase that access to our facility to have those experiences. So on any given year, we have about 100 nursing students who will rotate for their clinical rotations through our operations, gain that experience, see what healthcare is all about, get that training. We also have expanded our nurse residency program. So new graduates coming out of training, we're not just throwing them to the wolves, so to speak, and getting out there, is we're putting them in an educational and training program to increase their skill sets, provide them the exposure, guidance, and mentorship to be that. We're really developing that program. Once again, we want our nurses to stay with our hospital, but we're also giving them great experience that if this is ultimately not the right venue for them, that they are well-trained people that are diffusing into our community at large. As you mentioned, we have a close relationship with San Juan College. We're looking forward to expanding that over the years. We're also moving into a different focus for physician and provider training. We already have programs for advanced practice providers to come through here to gain some of that experience. We've also enhanced our partnership with Burrell College for medical students. So 3rd and 4th year medical students are doing their clinical rotations with us.
That's
so
great.
we've really enhanced that relationship. We're bringing these young people in here that are at a critical training stage of their medical school training to give them a great experience and also expose them to the really wonderful part of being part of the Farmington community and what they have available here. I think you mentioned it before, is like, we're not your average community hospital. We have a lot of really interesting pathology that passes through our doors.
Right.
Not only from a critical care medicine standpoint, but our approach to dealing with community-specific issues, our need to treat diabetes differently, nephrology,
kidney disease
service is just really, if you're approaching that and are interested into it, this is ground zero of where you really want to be. So really providing them a well-rounded, intense experience up here is really valuable. We're also super excited as we look at how we can better support our community and training is we are adding internal medicine residency program to our hospital. So I won't bore you with all of the bureaucracy of the challenges of a residency program, but within the health systems today, that's hard to do. Usually if you're expanding or introducing residency programs, it's considered above the cap. So it would be like 100% expense of the hospitals that are doing that.
Okay.
There are some new programs today that if you're focused on primary care services, you can add these programs and add to the cap. So we're excited and hope to be able to provide up to 6 per year over a 3-year residency program for internal medicine. So we're expecting to be able to have our first class in 2026. So coming right up, but we're investing in our relationships. We've got a good grant. We're putting the infrastructure in place to make sure that they're going to have a great experience. And so that's really identifying the physician faculty members that will be mentors and trainers in that, as well as mundane things like making sure they have housing, they have right resources, access to exercise in gyms and all of that good stuff. So we're pretty excited about being able to do that for our community and ultimately for our hospital. We think it's going to be a great recruitment opportunity. So once we get people here and kind of experienced in what Farmington has to offer, it's going to be one of our best resources for recruitment.
This is good news.
It is good news.
Yeah, and I love the just kind of behind the curtains think tank that's kind of putting this all together and expanding upon it on such a macro scale. But
Right.
you got to have that foundation laid first, and I just see you building these relationships that will, I believe, pay off for a very long time.
Yeah, and I think from the support of the board and the community, they've allowed us the opportunity to take a longer vision at this and know that there is foundational work that we're doing, both from the infrastructure standpoint to make sure that our facilities and our equipment and our capital is aligned, and that we're in a great position to build going forward. So I'm at a stage of my career where I'm looking at it as like, man, I've got 20 years of work left, but I'm not sure I have that much runway left in me. So really setting the stage for planning and development and how we're recruiting and really preparing for the future, for the next 5 years and then for the next 20.
Well, I'll tell you, Jason, one of the keys that I've found in my history and background is organizations who have a leadership team that is there for a longer period of time. Yeah. I know CEOs in every industry it's a 5-year turn, it seems like. But man, if we can keep you around and we can keep this vision going and stay on the mission for a long period of time, I think it'll pay off.
Yeah,
it'll really benefit us.
I know that we've had personal conversations. We're in. Becky and I chose to come to this community because the community is amazing. I was grateful to have the opportunity to be part of San Juan Regional Medical Center because when I set foot for the first day on that campus, I recognized that this is something exceptional. What's really interesting, just as an aside, is what is one of our best recruitments? You mentioned travelers. So we are still highly dependent on bringing in competent people to help us in those needs. But our best resource for recruitment are the people who are coming in from other states and getting the exposure to what this hospital has to offer, what this community has to offer, and the excitement about them being able to recruit to this area. I met a young woman in new caregiver orientation just this week. Grew up in Georgia and Tennessee. She's been a traveler. She was here in our critical care areas for a while, fell in love with the hospital, fell in love with this community, and chose to join us. She really is one of those great advocates of outside perspective, is like, wow, we really don't know what we have here sometimes. So love to have that perspective and share those types of stories.
I love those stories. I live for those stories. Those are the ones that refill your cup every day, for sure.
100%.
Real quick, I want to go back just briefly. A lot of people believe that San Juan County owns the hospital.
It's true.
Would you expand on that, just to dispel that myth?
No, I had to learn a lot of our history and structure over the years, and I am surprised that I'm kind of addressing that rumor pretty routinely. So we've been around since 1910. We have always been an independent facility. In the 1950s, there was an evolution as they were building the new hospital. And once again, I may have some of the history a little bit. I'm still learning. But the county owned the structure, and so that's when our corporation, came into existence. So if you're a not-for-profit organization operating in San Juan County, you have the ability to apply to be part of our corporation. And about 68 or so of those not-for-profits currently make up our corporation. But they are the oversight, they are the structure to a 501c3 private independent company. Our board of directors comes from the corporation, so you have to be a member of the corporation to be eligible to be one of our board members. So it is foundationally built to be part of this community. So we're not necessarily have Fortune 500 CEOs that are part of our board structure. It is people that are our neighbors, our friends, the people that we see every day in the grocery stores that are running that. That level of accountability is a whole different level of framework and stress, honestly, on that, because you are accountable to literally people who are living next door to you. So it changes your perspective. It makes sure that when you're asking the question of, well, is this right for the business, is this like, your first question is this right for our community? Yeah. So it really is amazing. But since we are a private company, we have the same stresses that any private company has. If we are not making our expenses, it's our fault. There is no outside firm that's going to write in and save the day for us. So we have to be good business people. We have to know how to pay our bills correctly. We need to be efficient and providing that service, because if we don't, we're going to have the same stresses as our friends at Target or friends at Kaiser or friends at anywhere else here. If we're not doing our business right, we're not going to make it.
Very interesting.
Yeah.
Not county owned. Very important. Separate. 501c3.
So we have a great relationship with the county. So they own a portion of our building, and so we have a very favored relationship with our landlord. And that does give us some advantages on how we can access, for example, some state dollars and do improvement projects, and how we kind of manage our capital. But no, we are certainly grateful for that. Because of the unique relationship, even though we're a not-for-profit, we do pay taxes in a way to support that. It's still a great deal for us, but lots of different mechanisms on how we give back to the community.
One of the other great services you provide is air care, the air ambulance, so to speak.
Yep.
Give us a little background of that, and it's a very busy air care.
My goodness. So as we talked about, if you look at the little dot and the vast area that we serve there, our air care ambulance service is a natural progression from that service. We serve the whole four corners, and you're going to have Robbie Donnell on this show once.
Because Robbie. That's a good idea.
He is an amazing advocate for it. He's going to do a presentation to our corporation in the upcoming weeks. But we are one of the busiest, if not the busiest, air ambulance services in the country. Because of fair weather, we fly often. So we're not really kind of constrained by a lot of that very often. We've added a third aircraft. Already having some of the busiest aircrafts in the fleet, we've added a third one. So our ability to keep those in the air is really kind of boiling down to workforce. Can we find enough pilots to do that? So the demand is there, and we are flying all over the place. I mean, into Colorado, into Utah, into Arizona to keep that. Kind of back to our whole mission is, what service does the community need? Is that access to competent, quick emergency services is fundamental to the services that we do. So our ability to fly out, respond to urgent situations, emergent situations, whether motor vehicle accidents or critical care issues in the surrounding smaller communities that need our higher level of service here. It's something that we're super proud of.
Well, that's great. We just added a third.
We did.
A third aircraft to the fleet. So
wonderful, unique opportunity. It was our ability to refurbish a plane and get it back into service. So we took a look at it. Does the demand warrant it? 100%. Do we have the capability to do it? We really dug deep to provide those services. So it is an amazing team of professionals that do that every day, that are flying into some of some really interesting situations to provide life-saving care.
You mentioned earlier kind of the accountability to a board of community members. I know you all have done a really, well, you've kind of upped the number of surveys that have gone out to kind of get the community's feel for things that they're concerned about, opinions about the hospital. I know there's one recently I just received in the mail, actually, the other day. So. Yep. What are you trying to do with those surveys? What's the point? Well, and why should people do them?
Yeah, the point is communication and know what's going on and be able to respond to what our customers and our patients need. I mean, that really is kind of the core of it. There's a range of surveys that we have. So I'm kind of, as I'm looking at you, I wonder which one of ours that you got. So as part of a participant in Medicare, there are certain requirements that we are obligated to do using the Medicare format of surveys, which is if you are a patient receiving these, some of the complaints we get is like, oh my gosh, this is multi-pages and lots of specific questions and really hard to do. Those are some of the ones that are required. We have some flexibility in the questions that we choose, but those are the ones that are going out, that we're working with our representatives in Medicare to try to make that an easier process so that we can get those responses and make meaningful decisions from what we're finding out. We also have lots of other surveys we're doing. So we work with independent private companies in some cases. Like we'll do a brand survey every year, and that's a different series of questions, usually kind of face-to-face, a little bit in writing, kind of getting a sense of how does the community see us? How does Durango view us versus people in Farmington and the surrounding areas? And that really kind of gives us a direction on being able to adjust in a more realistic kind of annual basis to kind of the needs or the perceptions of our community on that one. We also have started better utilizing a lot of the social media. So how we do Google surveys. We have to take it with a grain of salt, but a lot of the feedback that we're getting directly kind of online through these social platforms allow us to respond a lot quicker. We have to take that with a grain of salt because that's less kind of controlled environment, but gives us a really good picture on it. So we have to be careful about survey overload. We certainly have gotten some feedback from our own caregivers that is like, hey, we're getting these pretty often. So we took a break. We just this week launched our engagement survey for the year, reminding folks to say, hey, you've asked us to take a break from it. It's been a year. So please go out there, reflect on kind of what's going on in the years, and give us your honest feedback. It's important to us. We take a look at this. It's confidential, and we try to use this information to make sure that we're pointed in the right direction.
I think they're worthwhile. And typically, if the hospital sends one out, if the school district sends one out, I take the time to fill it out. And I do try and put some thought and look, kind of weigh the things that are good and maybe not so good. But I think the one I just received had a QR code to scan. That took you to the survey.
That's probably sounding like one of our Medicare surveys. Yeah. So I appreciate you taking time to do that. As you experience in this community, we're not as shy about giving our opinions.
Not at all.
So we appreciate that.
Yeah. Jason, anything else going on that our
listeners and viewers might want to know about the hospital? We covered a lot of ground.
I know, and I appreciate that. So we are really excited to be here. And once again, we have a long vision. We do appreciate our ability to respond to our community. We have intentions. We're just completed a refresh on our strategic plan. We'll be sharing that with the board and developing that over time. So we're really excited what the future holds for us and our ability to invest not only in the core infrastructure and preparing for the future, but meaningful growth, development within our community, looking at different access points around our communities, recruiting necessary specialists in the future. Is we are at the beginning, we are not at the end of that. So super excited about what we're going to be doing in the next few years. Well, I appreciate the foundation you're building and moving in that direction, and interested in learning more about the strategic plan when it gets completed. Wonderful. So. Well, we're transparent. So once we get it kind of finalized, we'll be socializing that to our community members as well. Great. Where can people go for more information about San Juan Regional? We always direct them to our website, and I want to make sure. I think we'll probably post that on there. Put on the yeah. But is it sanjuanregional.com? That's it. Yeah. Yep. And so we keep that up to date. We have a great team that controls that locally. So the information that you're seeing it is from your friends and neighbors, keeping you updated on what's going on. You also have a great newsletter too, by the way, that I think people can subscribe to. So it'll come directly to your email box every month. Absolutely. Yeah. And you can find access to that on our website as well. Wonderful. Well, Jason Round, CEO of San Juan Regional Medical, thank you for being here. Thank you for the invitation. Thank you for the work that you're doing. And I'm proud of our hospital. You know, I've had great service there. Been there a number of times for a number of different reasons with my family, and I think the level of care is exceptional. And for an area that's as rural as we are here, it's very fortunate that we have your facility, your care providers, and the services that you offer. And I'm excited about seeing them expand and recruitment opportunities, and any way that we can help you from the city, know that we want to be right there with you. Yep. So thank you. The partnership that we've had with the city is exceptional. It's different than most other communities I've lived in, and I really do appreciate it. So better is our mission. We know that we can be better, and that's really what we're working to do every day. Absolutely. Well, I think that's what we're all trying to do for sure. Well, thank you all for joining us here today. We hope you found this information important. Please share it with your family, your friends. Let's grow the reach of this great news source that we're using here to share the story of San Juan Regional Medical Center. And go to sanjuanregional.com. Stay apprised of what's happening there. And we'll see you here next time on the Mayor's Table.